Mr. Chairman, unfortunately, my time has lapsed because I, like you, love to talk and to ask questions, but I'll stick around to hear more of the conversation, and I yield back.
Thank you, Ms. This gentlewoman from Florida.
Thank you. Appreciate it. Thank you for holding this important hearing at such a point in time that is incredibly important for all Americans. I am the newest United States Senator, proud to be here, but I didn't come here to do things like we always do them, business as usual. And one of the most disheartening things that I have experienced in the last year is our country is going into debt faster than any other time in history, so we do things as usual. We just found out that there's more fraud built into these subsidies than we ever imagined from our own government watchdogs, so let's do things as usual. I mean, it's insane, the irresponsibility of that approach and our obligations to the American people. And so I appreciate this hearing because I think it's important that all of us learn more and come up with ways to do things better for the people that we represent. And specifically, I want to talk about a report that just came out in terms of the fraud that is in some of these subsidies. Just last week, the Nonpartisan Independent Government Accountability Office issued a bombshell report showing all kinds of egregious fraud, like tens of thousands of dead people receiving subsidies, people claiming more than 365 days worth of benefits in a year, government accepting clearly disqualifying information. And yet, as we meet here, we have people on the other side of the aisle that are continuing to push to nullify a president's rule that was meant to crack down on some of this fraud. The proposal, at least out of the Senate, was to just continue doing things business as usual, keep pushing taxpayer money out the door, even though we know so much of it is going to bad actors. And I refuse to accept that. As a former federal prosecutor, as a former federal attorney general in Florida, I refuse to accept that business as usual is going to cut it for this country's future success. And so I think we need to create something that works just as badly as we need to fix what is currently broken. And I would like to start with you, Mr. Roy, a couple of issues. Let's start with fraud. We saw the GAO's report of this outrageous fraud that plagues the healthcare subsidies, the Obamacare subsidies. And this is on top of the well-established fraud in Medicare, Medicaid, and state-level health programs already, like what's happening in Minnesota. And this is an inflationary force. This drives up costs as well. It makes healthcare more expensive. And I believe that so much of this fraud, and so many people report to me that the people in place right now, both in and out of government, know that this is taking place. And it's ripping our social safety net apart, jeopardizing its future success. What has been the impact of fraud on American health programs, and what can we do to combat it? And do you think, the most troubling thing to me is there's not one person solely responsible for instituting, rooting out fraud, and bettering our structures in place to prevent it. Do you think we should institute something in whatever legislation is proposed to have a healthcare fraud czar?
Welcome to the Senate, ma'am, and thank you for the questions. As you rightly noted, program integrity is a huge problem across all of these federal programs. The fraud rate in Medicare is about 10%. It's estimated to be at least 10%, which is $100 billion a year. In Medicaid, it's somewhere between 10 to 30%, which is another $100+ billion a year. In the ACA, we don't have good numbers, but it's probably also significant, right? So we talked earlier, I think before you came in, about specifically the ACA piece, which is there's two pieces. One, there's the identity verification, which the GAO report mentioned and highlighted. There's also income verification. That's actually a bigger source of fraud in the ACA, where you basically are asked to give supply your estimated future income in the honor system, and then you get a subsidy based on that, as opposed to actually actual income verification happening retrospectively. So one of the statutory reforms, and goes to my larger answer to your question, the real issue is structure. You can have a czar that is a program integrity czar, and there are program integrity divisions within HHS already. But the real question is how you design the system is going to lead to more fraud or less fraud. And my argument, and what I try to describe in my written testimony, is that if you have a universal individual market where people are buying health insurance on their own with their own money, and yes, getting some assistance if they need it for vulnerable populations, with a look back on your retrospective income rather than prospective income, that creates a lot of the design that limits the ability for fraudsters to take advantage of the taxpayer.
Thank you. I see my time has expired. Thank you to all of you for being here today. It's so important, and we appreciate your testimony.
Thank you, Senator. My friend, Mr. Byer.
Mr. Chairman, thank you so much for structuring this, and thank you all for coming. I've already learned a great deal. And Mr. Tingle, by the way, gamification, I'm on day 1,199 on Duolingo. It definitely works. So I'm double her, but she's good. So, Mr. Fiedler, many years ago, Mike Pompeo, before he was an important secretary and CIA chief, and I introduced site neutrality legislation on oncology, on outpatient orthopedic surgeon. And we've persisted every year with different partners. You're noticing that half of all physicians now work for hospitals. I know my own father-in-law had this wonderful little private practice, and when he retired, his partner immediately sold it to the hospital. But every time we introduce this legislation, every hospital system in Virginia comes to visit me and says, oh, we're totally dependent on these extra payments. I mean, this is how we pay for uncompensated care. We just can't make it without that. How do I respond to the hospitals that site neutrality actually makes much more sense?
So I think one thing to keep in mind is, one of the arguments I think related to this is hospitals argue that, the patients I'm seeing in the hospital outpatient department are just so much more complex and the cost, and therefore they're just much more costly to treat. So I need the higher level of payments. And I think the evidence we have looking at that is for the types of services that are being targeted in site neutrality reforms, these patients actually aren't meaningfully more complex than the patients that are being seen for the same services in a physician's office. And so I think one of the key arguments here is simply that these payments aren't higher because the costs are higher. The payments are higher because we've had two payment systems that we just failed to line up with one another.
Great. Thank you very much. Mr. Roy, very much appreciated your testimony. And as a small business person who did the health insurance, for 46 years, I'm impressed every time we do major healthcare reform. It seems like all the economists across the political spectrum, left to right, think we should do away with employer-paid health insurance, either tax it or just do away with it. But I also know that the political pushback is enormous. Do you have any suggestions how we move from where we are to where we should be, a la Switzerland?
It's a great question, and I'm a veteran of those political wars, so I know exactly what you're talking about. The thing I described in my testimony was just that. I would love for there to be a standard deduction or a cap on the unlimited exclusion for the ESI. That would be great policy, and I was sad when the Cadillac tax got wiped out. Having said that, I think if we're not going to go back to trying to limit the exclusion, another approach is to create a functioning individual market in which the plans offered in the individual market are so good in terms of affordability and quality. And we've also legalized the ability of employers to fund workers to buy those plans on the individual market. Then people will just, if you give people the choice in your small business, let's say were able to give, and you are actually now able to give, let's say $5,000 per worker in an HRA and an ICRA plan for that worker to then go shop for plans on the individual market. If those plans were a lot more affordable and a lot higher quality than what you could negotiate as a business owner in a group plan, then people will naturally gravitate to that individual market, even if you don't cap the employer-based exclusion. So I think there are ways to do this through gravitational pull and something that creates positive incentives rather than simply capping the incentives on the employer side.
As long as I'm asking you hard questions, I was also impressed with your notion that the people in FEHB should migrate to the ACA. I represent more federal employees than anybody in America. I think your idea makes enormous sense. Can you tell me how to make that happen?
Yeah, well, this is why you're the elected official and I'm just a guy with a keyboard. The calculations it's actually pretty powerful. So one of the problems with the federal employee health benefits plan is that the government pays 72% of the premium, whichever plan you choose. Effectively, I'm a little bit oversimplifying. And when you combine that with the tax exclusion for employer-sponsored insurance, what that means is if I choose a plan that's $100 more expensive, I, as the employee, only pay $17 of that. And similarly, if I choose a plan that's $100 less expensive, I only get $17 of the savings. So I have no incentive to choose really a cheap plan. But the way the ACA subsidies are structured, and this is modeled after Switzerland actually, is if you choose a plan that's more expensive, you pay the difference. The benchmark plan is covered, but anything above that you pay for. So if you move people to the silver plan in the exchanges and pay 72% of that, I estimate, our organization estimates you would save $10 billion a year. And that could pay for things like reinsurance and other things that would increase the protections for people with pre-existing conditions and poor health status. So you can make the exchanges actually work better for the healthy and the sick through reinsurance and fund that by putting more federal employees on that system, which also then increases the size of the exchanges, creating economies of scale. So to me, it's a win-win-win if we were able to do that.
Mr. Roy, the chairman says with a tight response.
Sorry.
FEHB with my wife, inexpensive. Exchange, I'm 75 years old, very, very expensive. What's your thought on the age rating on insurance?
So similarly here, what we do now is we effectively punish young people through the 3-to-1 age band. So an actuarially fair age band would be 5-to-1. That's what insurers tell us. And and the paradox is the 3-to-1 age band was thought to say, well, this will help older people and hurt younger people, but that's okay. But actually, the older people get hurt too, because when the young people drop out, older people's premiums go up as well. So widening it to a 5-to-1 age band, but preserving the subsidy structure allows us to hold the older individuals harmless, protect their premiums, but also include and incorporate more younger people into the system. And you can age adjust the subsidies if necessary to account for that as well.